All right, let's jump right in. We're going to talk about something pretty incredible today. A single, tiny bone in your neck that gets overlooked all the time. But here's the thing. It might just be the hidden key to a ton of your chronic health issues. We're talking about the C1 Atlas, which you can think of as the body's master switch.
So, let me ask you something. Think about those nagging headaches you get, or that brain fog that hits after you've been staring at a screen for a while, or just that constant grinding stiffness in your neck. What if all of it, could be traced back to just one tiny 2-ounce bone? It sounds kind of wild, right? But it's a really powerful idea, and that's exactly what we're going to unpack.
Okay, so this is it, the Atlas, or C1 bone, and we call it the master switch for a good reason. See this little ring? It's totally unique because it doesn't have a disc above or below it like the other vertebrae. Its main job, its only job really, is to cradle the base of your skull and protect the brainstem, which is, unbelievably delicate. And because of where it sits, right at the top, it has this huge outsized impact on pretty much your entire system.
Now this is the part that blows my mind. We're not talking about some massive, obvious injury here. A misalignment can be as tiny as 2 millimeters. That's less than the thickness of a nickel. But that tiny, tiny tilt, that's all it takes to start messing with your nerve signals, choking off blood flow, and basically kicking off a whole domino effect of problems all through your body.
So, when that master switch gets nudged out of place, what really happens? Well, it sets off this cascade effect. A tiny problem up top creates some really big issues downstream. Let's dig into exactly how that works.
This chart really lays it out. You can see how a misaligned atlas directly leads to specific symptoms. For example, it can literally squeeze the arteries that feed your brain, and boom, you've got a throbbing migraine. Or it can irritate the nerves that control your heart rate, causing those weird, sudden spikes in blood pressure. Pinch another nerve, and you feel dizzy. It can even block the fluid that drains waste from your brain, which is why you might wake up with that awful pressure headache. It all connects.
And look, this isn't just a guess. There's real data on this. A 2023 MRI study showed that if your C1 is rotated by just 2 degrees, that's nothing, it can squeeze that crucial vertebral artery and reduce blood flow by 10 to 25% just from turning your head. Think about that for a second. A simple head turn could cut off a quarter of the blood flow to parts of your brain. That's a massive consequence from such a tiny little shift.
The really tricky part about this is what we call symptom creep. It starts small. You might just brush off the early signs, right? A little pulsing at the base of your skull, some dizziness now and then, that brain fog after a long day at the computer. But if you let it go over months or even years, those little things can morph into constant neck grinding, ringing in your ears, or even high blood pressure that doctors can't seem to figure out. It's this slow burn problem, and most of us never think to connect the dots back to that one little bone.
And the long-term risk? Well, it's pretty serious. If you don't address it, that constant strain kicks off this 3-phase path straight to cervical arthritis. In the first few years, it's a functional problem. Ligaments are strained, discs start to dry out, but then you hit phase 2, where you start getting real structural damage. We're talking shrinking discs, bone spurs starting to form, and if it goes on for 15 years or more, you hit phase 3, that's when those bone spurs can literally fuse your joints together. You're looking at severe loss of motion, maybe even tingling and pain down your arms. It's a progression from a simple problem to permanent damage.
So what's causing this in the first place? What's pushing that master switch off kilter? Well, a lot of the time, the culprits are things we do every single day without even thinking about it.
Yeah, I'm guessing a lot of you are going to see yourselves here. That forward head posture from sitting at a desk all day, that's a massive one. If you play contact sports, even something like soccer where you're heading the ball, you're putting a ton of force right on that spot. Anyone who's been in a car accident and had whiplash is a prime candidate. And honestly, even something as simple as how you sleep, stacking up too many pillows can put your neck in a bad position for 8 hours straight, every single night.
This right here, this quote, really drives the point home. For every single inch your head moves forward, it's like adding an extra 10 pounds of weight for your neck to hold up. 10 pounds. It's like you're trying to balance a bowling ball on your head. Just think about that the next time you catch yourself slouching over your phone or your keyboard.
Okay, so we've talked a lot about the problem. Let's switch gears and talk about solutions, because the good news is you're not stuck with this. there are absolutely ways to flip that switch back to where it belongs. We're going to look at some simple fixes you can do every day and also what a professional reset looks like.
A lot of this stuff is actually pretty straightforward. These are simple habit swabs you can make right away. That classic phone neck? Just make a conscious effort to hold your phone up at eye level. Tossing a heavy bag over one shoulder all the time? Swap it for a backpack that distributes the weight evenly. And yeah, it might be time to ditch that mountain of pillows for just one good, supportive contour pillow. These seem like small things, but they make a huge difference in taking that daily strain off your atlas.
In fact, here's a little drill you can do literally right now, wherever you are. Just sit up tall, put your feet flat on the floor. Now, keep your eyes level and just gently pull your chin straight back. You're kind of giving yourself a temporary double chin. Hold that position for about 5 seconds. Take a nice deep breath into your ribs, and then release. If you can do that just 5 times, once an hour, you'll be amazed at how much it can help decompress that C1 joint.
But what if you've done all that and you're still struggling? If the habits have been there for a long time or your symptoms are more advanced, then a professional reset might be the answer. This is where targeted adjustments come in.
And when we say adjustment, it's not a one-size-fits-all thing. There are a bunch of different techniques. For instance, the Thompson drop technique uses a special table for a really gentle impulse. It's great for people with sensitive necks. Then there's something called toggle recoil, which is this super specific, quick impulse with zero twisting. The main takeaway here is that there are multiple, very precise ways to target the atlas, and they're not all about cracking and popping.
So, the big question, does this stuff actually work? Well, let's look at the numbers. This patient audit followed 47 people, and after just 8 weeks, the results were pretty undeniable. Their average migraine days per month cut by almost half. That forward head posture, it improved by nearly 30%. And their score on the Neck Disability Index, which basically measures how much neck pain impacts your life, dropped by a whopping 42%.
Let's just let that sink in. A 42% drop in both migraine days and neck disability in just 2 months. I mean, those aren't just numbers on a chart. For the people in that study, that represents a huge, dramatic improvement in their actual, day-to-day quality of life. That's getting your life back.
And finally, to make sure these results actually stick, the approach has to be holistic. It's not just about one adjustment. The precision adjustment is the core for sure, but it's often supported by other things like targeted supplements to help calm down inflammation, or even advanced hormone testing. Sometimes a cortisol imbalance, for example, can keep your muscles from ever truly relaxing. So it's about resetting that master switch and then doing everything you can to make sure it stays right where it's supposed to be.
So, we'll leave you with this to think about. Now that you know all about your body's master switch, the C1 Atlas, you have to ask yourself a pretty important question. When you think about your daily habits and you think about the symptoms you've been putting up with, is your master switch working for you or is it working against you?